When you're doing your medicine interviews, it's inevitable that at some point during the interview, you get a question that you don't know how to answer. So this video is going to tackle the what to do when you don't know what to do type questions. We're going to look at some do's and don'ts, and then we're going to look at 3 scenarios where these might occur, 3 situations, and then exactly what you do in each of those to how to get out of that sticky situation of getting a question that leaves you stumped. So this happens at every interview. It's plain sailing, it's going really well, you think you're cruising along, and then suddenly they drop a question that you have no idea how to answer. You feel yourself starting getting nervous, your heart beats fast, you start losing that mental clarity that you had, and you start waffling a little bit about what you're going to say. So here we're going to talk about what do you do. Because the first thing is that it's normal. In your medicine interviews, they want to put you under this sort of pressure, particularly if you're applying to Oxbridge, where they want to see how you are when you're put under the cosh and get put in a difficult situation that you don't know exactly what to do. Because this is what it's like in real life. So don't worry about it, it's completely normal. Medicine, even the most senior, the most expert professionals in medicine, the professors, the research leaders, the top consultants, they all have similar situations. There are situations where they don't know what to do. They are stumped by a case or a certain bit of data or a figure or whatever it is that is not something that they're used to seeing, and it's really how you respond to that. It's not trying to say you have to know the answer every single time. It's how you go about knowing the answer or going about working around the situation when you don't know the answer and demonstrating your ability to do that. So we'll talk about some do's and don'ts that you should make sure that you do when you get in this situation, and how to get out of it elegantly so that you don't jeopardize your chances at interview and come across scoring highly. So before we look at the frameworks, let's look at some do's and don'ts. The first don'ts are don't lie, don't waffle, and don't panic. Those are really important because what they do is take you from being someone who's methodical and in control to somebody who just seems like they've shook under pressure, which is something that they don't want to see in a doctor. What they want to see is that you have established a way of thinking, a framework of thinking, which is exactly what we're going to teach in a moment. And by showing a framework, you're showing that you're methodical and that you're clear in your thinking, even when you don't know what to do. Because when you are in a crash situation, for example, as a doctor, they want to see that you've got a framework that you work through, the ABC of resuscitation, as we call it. And that is going to show that even when you're not exactly sure what's going on, maybe somebody has arrested and you don't know exactly why, that still you can go through some steps to go about doing the right thing that's going to at least help sort the patient out, and then maybe go on the way towards diagnosing what the problem is, analysing the root cause, and then being able to fix that before. But at the same time, you're not flapping and doing something that's either not helping or detrimental to the patient whilst you're trying to work out what's going on. And then for some do's, my first do is to be honest. So like I say, don't lie. It's clearly abundantly obvious when people are just trying to blag it and they kind of get themselves into a corner, and then really what happens is interviewers smell blood and they keep going and they just want you to admit that you don't know. So we'll look in the frameworks exactly how we do that honestly. The other do is to be comfortable with working through the problem. What they want to see is that you're methodical, and like I say, that you've got a way of addressing an issue, and then that you can just work through it, think out loud, and actually just take them through your steps so that they can understand that you're thinking along the right lines. Then the final do is curiosity. Just be curious and interested and have a real desire to solve the problem. Show them that you want to know the answer, and you're going to then go and set about to working out how you can answer that question. So now we're going to look at 3 situations where you might be in a situation where you get asked a question that you can't directly answer. So for each, we'll look at a way to go about them and the 3 common type of situations that you'll find where you might struggle with an answer. So as I said, the first step is to start with honesty. And what I would say is start with something like, I don't know, and just be very honest. I don't know the answer, but I think it might be this. And if my assumption is correct, then I think that would lead to this, which would lead to this, and therefore that would give me this answer. And essentially that's what they're saying is, you might not necessarily know the truth, you might not know the answer for real, but you think and you're based on assumption, and you're essentially working through how one step would lead to the other to lead you to your final answer. And then you kind of acknowledge at the end, say, this might be incorrect, this might be something that would need revision or something that I would need to consult a colleague with if I was in the real situation. But for now, that is how I would go about solving that problem. And that's just showing that you honestly are aware that you don't know the answer, but at least then you've employed some steps of rationality that are going to lead you from A to B. The second type of question that's going to stump you is an explain this type of situation. What might happen, usually at Oxbridge universities, they'll present you with something that's very complicated, something that you probably have never seen before. They might want to get you to explain how it works, maybe what it's like on a granular level. Depending on the situation, they just want you to explain something. So again, here, we're not pretending that we know. What we want to do is, again, start with an honest answer. Say, I don't know. But here what we're trying to do is to think through it out loud. So essentially, start with the basic principles. Start with the most basic thing that you know in relation to this subject. So let's say it's an Oxbridge thing and they're trying to get you to explain how the biology of a certain animal works. You might just start by saying, well, I know that fundamentally this is true. And based on that, I would assume that it's probably this is the next thing in that step. And again, we're going through a rational stepwise approach. But the important thing here is to actually just show your thinking out loud, because that's what they want to see. Instead, what a lot of people do is just panic, just go completely silent, completely introverted and get very coy and kind of become very shell-shocked by the whole question. And then they can't see that there's something going on in there that's ticking along that at least is thinking about the problem. So take a breath, just say, like I say, I don't know, but what I think it is this. If you're in an Oxbridge interview particularly, they might say, well, didn't you do GCSE physics? Why don't you know this? They're just doing that just to see how you respond to it. You could respond to that very charmingly by saying, yeah, I know, I probably should know this, and laugh it off. But really what they want to see is that you're not shaken by a difficult question and then kind of being challenged by them saying, well, you should know this sort of thing. The final thing you might get is a scenario where you're not sure what the correct way to solve the problem is. And it might be a very tricky one where there is really no right or wrong answer. So what you want to do is first justify what you want to do and the principles that you understand for why you want to do that. So usually that will lay on ethical principles, and actually if you want to learn about how to answer ethical questions, you can check out this video here. Otherwise, there's a whole series that I've done about interviews and how to prepare for them, the 12 key subjects that come up, and I've done a whole playlist for that which you can check out here as well. But what I would say is go about explaining the things that you do understand, what the relevant pieces of medical law are, what the ethical principles are, and some of the important themes that I discuss in that playlist that you can discuss and make sure that you demonstrate some knowledge about. But then based on those, you can then start to justify what you think it should be. And then really the ultimate get out of jail card, if you really don't know what to do, is you memorize this quote and you say, I would seek the advice of a senior in that situation whilst maintaining patient safety. And essentially that demonstrates that you show the limits of your knowledge. You know that you've always got somebody senior or a colleague that you can consult with if you're not sure on an answer, and that your priority is to maintain the patient's safety at all times prior to anything else. So that really covers the basics of what to do when you don't know what to do. The main thing is to not panic and just say nothing, and just show them that you're still an intelligent person and that you're not perfect, you're not going to know everything, but at least when you get backed into a corner and you don't know what to say, that you've got a method of getting out of it and working your way out of a problem. If you've got about a week left of your interview, or a couple of days, or even a few hours, I recommend that you check out this series here. It's 7-minute videos of all the 12 subjects that you need to make sure that you're really hot on for your interview. It's going to tell you all the key information that you need to know. It's the shortened version of my online course, and it's going to get you set up and give you nice refreshers just before your interview. So thanks for watching, and I'll see you over in one of those videos.